Dr. Jennifer Dore, welcome to Shrink Wrap Radio.
No, thank you. Thank you so much for having me. I'm excited to do this interview today.
Oh, that's good. I'm glad you're excited because I'm excited too. And, I've been following developments in psychedelic-assisted psychotherapy. And Jonathan, my nurse practitioner's son, uh, suggested I absolutely should be on your show because he was in a workshop that you were doing, I think,
hmm
and
hmm
he was smitten with you,
Oh,
and said you would be so great for this. Um, so to jump into this, when did you first learn about ketamine-assisted psychotherapy?
let's see. Um, I started out originally. Actually, I did my training in general surgery, and I switched from general surgery to psychiatry, and that's a whole other story.
That's that's a big switch.
It is. It's a big switch, but I think it really influenced my training and the way I practice, and I'm really happy that I did that. But and in terms of psychedelic medicine, I think it really puts me in a good position because I have this perspective on psychiatry that really is influenced by this sort of procedural mind that I developed as a surgeon. So that's definitely one of the influences when it comes to my interest in this. But
What does that mean, a procedural mind?
well, I think even before I discovered psychedelics, I was interested in psychotherapy and medications as a psychiatry resident,
Oh,
and I
good.
saw it as a procedure, sort of a procedure in the mind, the psyche, the spirit, and it, when it comes to long-term psychotherapy, it's sort of a prolonged procedure as opposed to procedure that lasts a few hours. But I really viewed it that way. And I viewed my training as an opportunity to gain skills to allow me to perform this procedure
Yeah.
that required preparation, but it also required one to be able to improvise because human beings are so complex and unpredictable, and sometimes we have to do whatever we need to do to um, participate in the procedure. And I think it really gives a nod to where I think mental health and health care in general is going, which is more towards transformational medicine as opposed to just treating symptoms, whether that be in physical health or in mental health.
Yeah.
So transformational medicine a lot of times requires procedures. Um,
Okay. Well, I like the gist of that it required, you saw it as requiring improvisation. And I tell you, if I have to do the same exact thing over and over again, I go brain dead just so fast.
Me too.
And,
Yeah,
and so it's great to have to adapt, to each new person and each new situation, I think. And that's
absolutely.
that's part of what I like about doing these interviews too, is that each person is different. Every interview is different. Lots of different topics and so on. So we're on the same page there. So how did you, so you somewhere you learn, I
So
guess I still haven't heard,
I did my
when did you
psychiatry.
first hear about ketamine-assisted psychotherapy?
Well, at Stanford, there was no such thing as psychedelic-assisted psychotherapy when I was a resident, and I graduated. I decided because I had done 2 residencies at that point. I had made the decision between kind of joining Stanford and being a professor or going out on my own and doing private practice, and I really wanted to start to treat patients. I was really excited to do that and to create and to just kind of jump in there. So I started my private practice and it was going great. And I was practicing psychotherapy and learning and doing medication management and trying to figure out the best way to combine those things. And then there was a subsection of people who weren't getting better. And I it's just the way that I think is just like, okay, well, so we got to figure out why, what tool do we need?
Good for
Um,
you.
and how do we approach this? And if I'm not getting through to someone, it's not that there's something that we're not addressing. And so I went to look for new tools, and I really did think back to my surgery residency and to some other experiences that I had had with psychedelics in my younger years. And I thought, hey, you know, I wonder what's going on. I had vaguely remembered that there were some research studies on MDMA-assisted psychotherapy and the work of MAPS, and I heard that briefly during residency. So I went on a quest, and I found Dr. Phil Wolfson, who was practicing in Marin, and he had on his website, you know, ketamine-assisted psychotherapy. You know, he was one of the investigators for the MAPS MDMA trial for life-threatening anxiety.
Okay.
Called him up, and sort of consistent with my personality, I said, hey, you know, I saw this thing on your website, and I'm really interested in learning it, and I was wondering if you could teach me. And, you know, I didn't know if he would get back to me, but he called me back, and he said, hey, come on up. So I went to meet him, and the rest is sort of history. And he taught me the method of ketamine-assisted psychotherapy, which is a method that he really adapted from the MAPS MDMA-assisted psychotherapy and his experience in the psychedelic medicine community, you know, for many decades. So.
Yeah, so I was interested to hear you cop to that you had some psychedelic experiences as a young person, maybe before you got into medicine. What can you tell us about that? I've been open about that now for some time for myself. You know, I was in graduate school in the 60s and explored everything that was available to explore. And it seemed important, you know, that, hey, here was something that had a profound, you know, at the time they were calling a psychotomimetic, you know, that it was a way to better understand the experience of being crazy, quotes crazy. And so, you know, that's part of the way I justified it to myself. Yeah. So what was your experience?
Well, the first time that I had an encounter with psychedelics was in college. I went to Amherst College in Massachusetts, and where I met my husband, whom we just celebrated our 17-year anniversary. And so my first experience was with him, and we did psilocybin up in Amherst with a group in the evening one night. And it was a really beautiful experience. I guess I was maybe a sophomore in college at that point, and it really opened me up into this sort of sense of spirituality and discovering all these different parts of myself and understanding relationships. And I, you know, much to my husband's chagrin, I sort of referenced that experience over and over and over again. And it was really, you know, quite symbolic for me and our relationship and even the work that I do now. So I really look back at that as a really important experience. I didn't know at that point that it would be something I would use in this context, but it was really a very positive experience.
Yeah.
And, you know, I had experimented with psychedelics, and, you know, I can't, even though I'd like to say that I was a psychonaut, I wasn't really a psychonaut. I was this pre-med English major who was kind of nerdy, but I had these experiences that were really fundamental. And so, you know, I really think that it was important in terms of my evolution at that point.
Yeah. You know, it's hard to know about the path not traveled, but I certainly feel, you know, I can't know what would I have been, who would I have become, what would my career have been like if I had never experienced psychedelics. But because I did experience psychedelics, I think it's had a big impact on my career. I'm not sure I would have a podcast like this had I not had that experience, because one of the things that opened up for me was the realization that, hey, there's a lot more going on than meets the eye here in this universe. And, you know, and no one approach has got all the answers or the truth and so on. And for me, that was an important piece of learning, particularly in psychology, where they were wanting to be recognized as a science, and so trying to be as tight-laced as possible, you know, so that you'd be unassailable. No, that didn't work on me.
Yeah, I think I sort of stuck with the notion, you know, the first psychedelic experiences I had, they sort of primed the way, and then I I didn't have any more psychedelic experiences again. Like I said, I became a general surgeon, and I was married to my husband at that point. And the process of being a surgical resident was quite psychedelic and psychomimetic. And I think going through that process, and then deciding actually to have my daughter was extremely transformational to me. And then I sort of came out on the other end, in this really transformed place, sort of ready to embark on this journey that I am on right now.
Yeah.
And symbolically moved to California from New York City. So it was really this mixture. And I like that it happened that way, because I feel like psychedelics are this incredibly important tool, but they're one tool, and there's so many things that can be transformational, and psychedelic experiences can, life events can. And so I really emphasize this notion of transformational, and how I've always been interested in, especially after being a surgical resident, like how do all these different things come together, to produce a transformation. And after I went through that career change and life change, I really was asking myself that question, which is the same thing that I ask now when I practice psychedelic medicine. Is like, so what happened? I mean, I really like where I am right now. Like, what were all the elements that kind of came together to produce that wonderful, sequence of events?
Yeah. Yeah.
So I really focus on that now, because I use, and I think we all are trying to use the psychedelics as catalysts for these transformational events, and helping people to kind of put themselves in a position where they're open to transformation, as opposed to just sort of hanging with the status quo.
Yeah. Now, I'm aware that ketamine has been used in a wide variety of ways. What can you tell us about the history of ketamine? For example, one thing I heard was that it was a horse tranquilizer. And if it was a horse tranquilizer, how in the world did we get to using it in this way? But just anything that you can tell us about the history of ketamine and some of the other things it's been used for.
So I love this question, because I think it's really important as we move forward for people who are using psychedelics in medicine, and those who will come to kind of use them as a toolbox to understand this. And it's something I'm very passionate about, because it has implications for how we use ketamine today. So ketamine grew up in the medical model. I mean, I guess it's always been a medication that's been used by the psychonauts. I mean, it was used by Salvador Roque, and usually at the very end of his, psycho-mimetic weekends that he used to put on in Mexico. And there's a lot of really interesting stuff written about that in terms of the sequencing of the psychedelics. But ketamine was discovered as an anesthetic in the 60s at Park Davis, and it was, they were looking for a novel and better anesthetic agent, because, and this also harkens back to my surgical career, and that anesthetic agents are perfect when they make it so you don't remember anything about the procedure.
That's what I like.
They take care of the pain, so they're an anesthetic as well, and they're an anxiolytic. And so if there's a medication that has all those properties, it's really the ideal anesthetic. And then also sometimes you need a paralytic agent. So instead of using 4 agents, we, anesthesiologists really like to be elegant and use, less medication. Well, so in the quest for discovering the ideal anesthetic agent, first they discovered PCP, or angel dust, which may be surprising. And, that had some problems, because people would wake up agitated. And so they kind of threw that out. They were like, nope, that one doesn't sort of make the grade. And then it became a popular recreational drug. And then they discovered the cousin of PCP, which is ketamine. And ketamine is actually quite a good anesthetic, but in a percentage of people, they had what was called an emergence reaction, which was sort of like the agitation that people on PCP were experiencing. But as they were waking up from anesthesia, they weren't prepared for the fact that they were going to be in a dissociative or psychedelic state. So they woke up and they were pretty anxious and they were screaming. And so then they said, well, even though this is a really good medicine, it's really safe, it doesn't depressed respiration. We can't have this going on in the recovery room. So they said, well, let's give it to the vets, because it doesn't, or at least not as much as we know, it doesn't happen, with the animals, this emergence reaction. Let's use it for kids, because interestingly, kids, or at least this is what I'm told, I don't treat children, kids, when you're setting their shoulder and they have a dislocated shoulder, you give them ketamine in the emergency room, they don't have a dissociative reaction. Maybe it's because the boundary between fantasy and reality is really, not so definitive yet.
Yeah.
But, yeah. So that's so it was there. So then it grew up in this medical model. It was used by the anesthesiologist. They used it for chronic pain because it was actually a really good anesthetic agent. And they were giving it to people who had chronic pain in the outpatient clinics. And they were using it as anesthesia, mixed in for different things, but not that often. And so they developed a safety profile. And then they noticed that, wow, people who were being treated for pain were less depressed. And then they were like, is it because we're treating their pain, or is it because they're less depressed? And then it sort of took off from there, because the analgesic property was really kind of separated from the antidepressant properties. And then people started researching it. And that's how we got to where we are now, which is that ketamine is the only rapidly acting antidepressant that we have. And it's extremely effective for people who have depression, especially suicidal depression. So instead of sort of growing up like MDMA in the psychedelic psychotherapy model, even though people were using it for psychotherapy, not just Roquet, but other people, it wasn't as popular as MDMA, or at least this is what I hear, that it really, the main place that it was sort of growing up as a psychedelic antidepressant was in the medical model. So it's kind of stuck there, even though many of us are trying to, and I feel really passionate about this, trying to kind of pull it back and kind of, put it back where I think it belongs, which is with MDMA and psilocybin and within the psychedelic toolbox. And I think a lot of us who are in this community would agree that that's where it belongs, and that even when these other agents are FDA approved, that it will be a very important tool in the psychedelic toolbox.
So you want to pull it back from being seen strictly as a medical agent for anesthesia? Is that it?
What was happening was because it was used by the anesthesiologists, when they started to research it for depression, they would give it in an IV, and they would give it as a drip. And they would have this weight-based protocol. It's called the NIMH protocol. And they would give, a certain milligrams per kilogram, and they'd put in an IV, and they would monitor you, and they'd put you in a clinic like a recovery room. And, if you can imagine, there's no set and setting, there's no support, there's nobody holding space. There's just sort of a nurse who's kind of turning the drip up and down. And so they noticed that had a really good effect with respect to depression, but that people weren't necessarily carrying forward that antidepressant effect, and nobody was integrating those experiences at all. So it was being treated just like a pharmacological agent for depression, as opposed to a adjunct to psychotherapy. And that's how I and others really feel like it works best as a transformational medicine, as an antidepressant that not only gives rapid antidepressant effects, but really allows people like psilocybin, like MDMA, for people to sort of confront deep trauma, to uncover unconscious material, and to really catalyze the sort of traditional psychotherapeutic process.
So it's really a tool that can get a person into an altered state of consciousness, and from there might be directed to maybe any number of psychological issues.
Absolutely. And the thing with ketamine that's wonderful is that there's this incredible dose range. If you give it in this sub-psychedelic dose, which we use with sublingual lozenges. We don't use IVs. If you can see, this is my office here. I have many rooms with comfy couches and
it looks like a wonderful place.
Attention to set and setting. And so people take it as a lozenge or as an intramuscular injection. And if you use the lower dose range, you really kind of, you produce an altered state where someone still feels like they're present, but their defenses are softened. Their anxiety comes down. It really affects fear. They feel a little bit altered. They feel like they can engage in sort of stream of consciousness. They definitely bring up unconscious material. And it's this sort of dreamy, floaty state that not only feels really nice from a physical perspective, but really gives access to different parts of the mind. And we know from a neuroscience perspective that it really acts on the neurons that are enhancing the left side of the brain and kind of enhancing those ego structures or telling those stories and those default mechanisms, I'm bad, I'm this, I'm that. It really quiets that. And we really have the neuroscience to show it. So in this low dose range, it's this sort of twilight, non-ordinary state that's really, really gentle and perfect as an adjunct for almost any kind of psychotherapy. Probably not CBT, although people do it, but any kind of relational, dynamic, therapy. And we're even kind of creating different modes of therapy that brings together different theoretical models, to get the best benefit.
Yeah, it reminds me of what I've heard about MDMA as putting a person into a state where they can talk about things that ordinarily would be anxiety arousing, but somehow it lowers that level to the point where they can talk about difficult issues without getting, quotes, triggered into a huge.
At the lower dose range, it's almost exactly like that. And I would say that for patients who are more severely traumatized, ketamine may not support them enough. They may need that really empathogenic flood of, dopamine and oxytocin and serotonin, if I'm going to talk chemically, or they need that warm hug of the MDMA and the support of the MDMA. But for people who have moderate to mild trauma, especially developmental trauma, we found that the ketamine, especially in this sort of sub-psychedelic or sub-psycholytic dose range, is perfect. It does the same thing, and we do the same thing as the MAPS protocol. I trained as one of the, I'm in process of the training for the MAPS MDMA-assisted psychotherapy program. They're training therapists for the eventual, approval and expanded access of MDMA. But it's really, really similar. We're, patients wear eye shades, they lay on the couch, we hold the space, we sort of do what we call inner directed psychotherapy, where we just really get the attunement right and we sort of follow the lead of the patient. And the medicine does a lot of the work. So it's really quite rewarding.
We've talked about MAPS on this show in the past, but it would probably be good to remind people that MAPS is an acronym, Multidisciplinary Associations for the Study of Psychedelic Science, or for psychedelics. You say it.
Multidisciplinary Association for Psychedelic Science, I believe.
That sounds right.
Uh-oh, Rick is going to get mad at me for not knowing that.
No, I think you got it. And
well, so then I can just say one more thing about the dose range, and that so you can utilize that lower dose range, and it's very well tolerated by people, and even people who have medical problems. We've given it to people at end of life and who have multiple medical problems. We've given it to people, we've given it to adolescents, although we use it a little bit differently. In my hands, it works the best in people who are sort of middle age and older. So the sort of ego dissolution or ego exfoliation is really, quite appropriate at that developmental stage.
It works better after they've had a chance to have an ego,
right.
to develop an ego, right?
Absolutely. And then, we do those sessions in office, and then we also prescribe ketamine lozenges for people to do some of the sessions at home in a really closely monitored way. In the nest of this general psychiatry practice, we're really keeping a close eye on things. But that allows patients to participate in their care and have some autonomy, and not just, develop a dependence on me, but they can do some of that work on their own. And then they can do some of the attachment or interpersonal work when they work with one of the practitioners. So it's really quite flexible. And then you can go up in dose, and that's where we use the intramuscular injections, where you really uh, can utilize a very psychedelic, probably one of the most psychedelic experiences with a ego dissolving dose of ketamine of 100 milligrams, for an average person. And that has a totally different, has a totally dissociative, totally psychedelic experience. And that experience is also can be utilized for patients, and they can kind of get used to the space using the sublingual lozenges, and that's really gentle, and kind of work up to that if they're really kind of going for a transformational effect.
Yeah. And so that would also probably get one into more of the quote spiritual realm.
Absolutely. Mystical
Right?
experiences, right?
Say that again.
Mystical experiences, right?
Yes. Yeah.
That's how we think that, at least from an experiential perspective, that the higher dose ketamine works is through generating mystical experience, which it absolutely does. And the really neat thing about ketamine is it really works with the individual. Some of the other medicines, and I'm pretty open about my own personal experience. I've used most all of them at this point. It produces an experience that really doesn't have that much of a signature. Ketamine has a signature, but it really works with the person, and it's very individual. So people say, oh, I experienced love or joy or God, and that's just ketamine. I say, no way. Not everybody sees God, and not everybody, has love, and not everybody, sees marshmallow mountains. Like it's so variable. And so when people reach that dissociative range where the central nervous system is detached from the peripheral nervous system, and you totally go into a dream state, and you don't remember where you are, how you got here, you think you've died. The first time that I did it, part of the whole process, which is part of the psychedelic tradition, is that you have to be familiar with the medicine that you are administering. So part of my training with Dr. Phil Wolfson was to take the medicine myself under his supervision. And first time I took IM ketamine, I got swooped up into this wave of energy, and he was playing the gong at the time, which before the experience I thought was a little scary, but then my energy basically broke into this beautiful mandala pattern, and I eventually reached this liminal space where I was a point of consciousness and didn't remember anything about who I was or what I was, and I just sort of there was darkness, and I said, well, I guess this is where I am now. And and I sort of accepted it, and I was just like, well, I'm just gonna have to be here now. And on the way back into my body, it was just really fabulous to have experienced myself totally without a body and totally without a persona. Really gave me this direct experience that my consciousness existed without my body, and I experienced my true essence. And I take that with me. I know it. I can really identify it, even though it was there all along. I was like, okay, the essence is there, and that's not necessarily in my body. And so that was so wonderful for me. And I've treated hundreds of patients with ketamine now, and I've just seen that, not that exact experience, but similar mystical experiences that are just so life-changing. So.
Wow. So you've seen hundreds already. It seems like it's kind of new to me. It's kind of new. I don't think we heard about ketamine very much until the last year or so.
Well, so I've been using ketamine for the last 5 years or so. That's when I started to learn it from Dr. Wolfson and his partner, Julian Andrews. And since then, I came back after kind of learning about it and having my own experiences, which is actually really important to the process. And I think it's going to pose some challenges as we sort of teach psychedelic medicine in the future. It's another topic I'm really interested in. You have to have your own experiences, and you have to do your own work, with the medicine and otherwise. But I came back and I gave it to my practice, anybody who wanted to do it. And then people started coming to me. And then I started to do these trainings with Phil and Julaine. We started this thing called the Ketamine Training Center. And so we started to train people, like groups of 20 people. And so in my practice, and then I brought people into my practice and supervised them. So we really, I've done maybe 3 or 4 trainings, maybe more than that, with 20 people, and then my whole practice over the last 5 years. So really gotten the opportunity. I feel very blessed to see lots of cases.
Yeah,
I
well,
see how.
that's wonderful. You know, one of the big issues, I think, there are a number of big issues surrounding this whole arena, but one is scalability.
Mhm.
And for example, if you just look at PTSD, there's a huge PTSD problem out there.
Mhm.
And so far, we don't have scalable solutions to meet the need is so much larger than, than the population of trained clinicians. And
Mhm.
so that's one of the areas that I think this area is struggling with. What is the approval slash legal situation with ketamine?
Well, so ketamine is legal. It's the only legal psychedelic medicine. I guess cannabis is also considered psychedelic at certain doses. So
Yeah.
I should give that caveat, but it really is the only legal psychedelic medicine. And in April, Spravato, which is actually a related product, it's a ketamine. It's I can explain what it is, but it's a ketamine product that was approved by the FDA that was put out by Janssen. So before that, it was legal because it was a legal anesthetic, and now the Spravato product has FDA indication for treatment-resistant depression as well. And so it's legal, it's used off-label, and most of the treatments that we use in psychopharmacology are off-label anyway. So yeah, it's very exciting, and I think it gets missed a lot because it is legal, and because I think some people have the impression that ketamine is not as warm or as gentle as some of the other medications. I think there's some stigma out there about that, but that it's absolutely legal, and it's off-label, and it has a considerable body of research now to support it. Most of the research has been done using ketamine in the IV model, but really delivering it through the IV or delivering it in an intramuscular injection, which is a shot into into one of the muscles, or through a sublingual medication or oral medication. There's a fellow, Stephen Hyde, who wrote a book, Ketamine for Depression, and in New Zealand, he gave oral ketamine to patients with fabulous results. And so yeah, it's really accessible. It's actually really cheap. The Spravato product isn't, although it may be covered by insurance, some insurances now, but ketamine is really cheap. And so what you're really paying for, at least when you come to a psychiatrist or a therapist to do it, you're paying for the person's time. If you go to an IV clinic, there's a lot more in terms of the setup, right? You know, the IV and the clinic time and so forth. And a lot of those ketamine clinics have kind of popped up.
Yeah.
Because the ketamine, it has a biological effect. I mean, if you just give it to somebody, it helps depression. But if you don't do the therapy along with it, then it has a hard time sticking. And we think that may have something to do with, like the other psychedelics, ketamine also affects the default mode network. And so we think that the ketamine, we know that ketamine actually makes the brain more neuroplastic. And so whatever you're doing at the time of the ketamine, or within 48 to 72 hours, we don't know exactly, is going to really have the ability to stick a lot better. And so you literally can, like Michael Pollan, change your brain.
Yeah, you said neuroactive, was that the term?
Neuroplastic. Neuroplastic. So it's like
Oh,
that.
neuroplastic.
Yeah,
Okay.
the
Yeah.
neurons can make new
Right.
connections,
To make new
much more.
connections. Yeah. Yeah. That's now, of course, when we say it's legal, that's for medically trained people. But I gather there are a lot of people who are not medically trained, but who are using it therapeutically because they've been through that experience and it's been powerful for them. And so they want to go ahead and use it with other people. Right.
Uh,
But that's not legal. They could get into trouble. Is that right or not?
yeah, I think we're in this position at this point, as we're at a crossroads, where ketamine's legal, and you can get it from a medical provider. It requires an MD or equivalent to prescribe it. And here at my practice, we have several practitioners that I supervise everyone, and a therapist can sit with the patient, but an MD really has to prescribe the medicine because there's that medical aspect, right?
Yeah.
And so, yeah, or you can get it in an IV clinic or from an anesthesiologist, right, in a pain clinic. But yeah, we're in this point right now where we have a lot of people who are practicing psychedelic medicine in what we call the underground, and there's
Yes.
and really brave, wonderful people who have been seeing the merits of these medications and giving these medications to people. Some of those people are medically trained and some aren't, and there's really a lot of knowledge and experience there, and that we really need to learn from and kind of come together as psychedelics become legal, and hopefully the foundation or some of the foundations of our mental health care. And there's indigenous cultures who have used psychedelic medicines in their traditions for long periods before we were even thinking about this. And so
Yeah, right.
wanting to sort of honor that and acknowledge that too, and really bring all of that together. I mean, I'm of the mind that the more knowledge that we have and the more we can bring that together, the better.
Okay.
I think the medical model is a good one for it to be, for the psychedelics to have a home right now, because it does need a framework, but I think we need to integrate all of these things in together. And so yeah, I think none of the other medicines are legal right now. And I remember I went to the second, there's this conference called the CREA conference, which is the conference about ketamine that was started by Raquel Bennett, who's a practitioner who's been using ketamine for a long time in Berkeley. She started this conference, and I was at the second one. I wasn't at the first one. I think the first one was, there was nothing out there about ketamine, and she brought everybody to a table to have dinner and kind of talk about, like, well, what are people's experience with ketamine? There are only a few people using it. And the second one was this big round table, bigger, not in a restaurant, but it was a conference. And I kind of, got sort of snuck in there when I first started using ketamine. And there were all these really brave individuals, anesthesiologists and psychiatrists and mental health providers, and maybe some underground people, I don't know, but they were all sort of sitting at this table and saying, this medicine is helping people and it eases suffering, and we want to respect it, and we know that we have to be careful with it, but we also can't not give it to people. And so it was really inspiring to go to that conference and really see how people were kind of sticking their neck out there and trying to be very responsible about the medicine, but also kind of being brave and pioneering. And so
I
I think
think I may have seen part of that, or I've seen the what was the woman's name again?
Raquel Bennett.
I think maybe I've seen her on YouTube.
Yes, she's wonderful. She has a presence in social media, and she's very outspoken for the cause of what we call ketamine-assisted psychotherapy, which is what I practice, and what Phil and I published a paper on ketamine-assisted psychotherapy in an effort to really bring, like I said, ketamine into or back to the sort of psychedelic toolbox.
Yeah. Now you spoke about the signature of ketamine, and that's a term that my son Jonathan told me about to kind of describe the expected profile that a substance might bring about.
Mm-hmm.
And so maybe we could touch on some of the others that are around these days. For example, ayahuasca. How would you describe the signature of ayahuasca, which is becoming just huge? People taking trips to Peru and other places, and Costa Rica now, and Europe, and
right.
yeah.
I can't speak as much about some of the other medicines, but because I have less case experience with them than ketamine, but I definitely can speak to it. And so ayahuasca is a mixture of a bunch of different things, and a brew of DMT and some other chemicals
Right.
that stimulate the other neurochemicals and emotional experiences. And at least, so the signature of being able to sort of treat trauma, of allowing one to see the spirit world and have profound hallucinations, but also emotional experiences at the same time. And as I kind of alluded to in the beginning, it's like, what are the different components that you need for transformation? What do we need to, what do we need to immerse a person in so that they can really understand themselves and dive deep and kind of, figure out where the little, psychological or spiritual kinks are. And so I think that ayahuasca, it definitely has an experiential signature, as I spoke of. And I think it's also very good for treating people who have been traumatized. It's also most traditionally given in a group setting, which, we've given ketamine in a group setting, both with patients and with clinicians, and that can be a really powerful, amazing healing aspect to it, of creating this community, even if the community is only kind of intact for a certain period of time.
Right.
There's a healing energy of the group.
Yeah.
And so those are some of the really important components. I'm sure I didn't cover all of them, that are important with ayahuasca. And there's actually been some wonderful research with ayahuasca as well. So I think that's going to be one in the toolbox. And the components, I think that DMT is, even though we don't talk about it a lot, I've been doing a lot of research on it as well. And it has tremendous capacity, especially 5-MeO-DMT, to, it's a very short duration. So it's something that providers could use, and it produces a lot of mystical experience, which I think could also be very important. And the after effects, and there's been some literature recently about it, the after effects of decreasing anxiety and depression. So there's
we just need a lot more research on all of this stuff, don't we?
Absolutely.
Yeah.
We really should.
Yeah, a lot of it is new in our culture. It may have been around elsewhere for a long time. Ibogaine is another one.
Yes.
That I've been hearing about mostly in the context of addiction.
Addiction and really severe PTSD. I think that, ayahuasca is wonderful, but ayahuasca is very powerful, and ibogaine is also very powerful for the most refractory PTSD. And there's some wonderful work being done with vets, with some groups that I am familiar with down in Mexico, where they're using ibogaine for vets and addiction. And so I think ibogaine is definitely going to be in the toolbox as well.
Yeah.
And, so there's some great work about kind of seeing one's entire life, being able to see moments in their life. And, a lot of us in the sort of consciousness community and the psychedelic community, talk about near-death experience, because, we alluded to mystical experience, but near-death experience in particular, which I believe you could categorize under mystical experience, can be very powerful. And if you research people who have had near-death experiences without psychedelics, you can see it has a powerful effect in helping people to sort of put their life in perspective, to increase gratitude, to decreasing shame, depression, anxiety, allowing people to sort of live their life, because they sort of were able to kind of touch death, and in that kind of have this review of all the things that have happened in their life. And so you look at the near-death experience stuff, it's very interesting because it's very similar to what some of the psychedelics reproduce.
Yeah, I have a good friend who actually, I was on his doctoral committee, and he did his dissertation on near-death experience, interviewing a number of people. And the thing that I recall, one of the main findings was they no longer had a fear of death.
Right. Mm-hmm.
That sounds like a good thing.
Yeah.
Yeah, and these were non-psychedelic. These were spontaneous experiences that they had.
I've seen, I've done some research into that topic, and I've seen that, and I've also experienced, the first I am ketamine journey that I did, that I described to you, where I became a point of consciousness. I mean, that was probably the main message of that journey, which was, I can't say I completely don't fear death at all, but pretty much having experienced that directly, where I was able to travel without my body, it really had a profound effect on that deeper sense of dread about dying. And so,
Yeah.
and I think that when people don't fear death, strangely, they are able to live. So,
Yes. So, where do you think all of this needs to go? And what do you envision? I'm also wondering, how do you envision your own work changing or growing as you look down the road?
hmm. Well, I think there's a lot of enthusiasm about psychedelics right now, and it makes me excited. It has increased awareness. People are a lot less hesitant to try these treatments, whereas 5 years ago, I think there was a lot more fear, and we mostly got people who had tried psychedelics before, but now that's changed a lot. So I think that I was asked this question when I was giving a talk at Esalen in the summer, and I envisioned that the psychedelic toolbox, hopefully will be available for practitioners to use, all the different tools, to help people. And I believe it's not just mental health, but I've noticed as my work so far that when you help someone's mental health, you just inherently affect their physical health too. There's such a mind-body connection. So I think they're going to be integrated, into the main treatment strategy that we have. Some of the pain points I think are there that I've been really giving some thought to is like, so how are you going to train clinicians to do this? What's it going to look like? How are we going to sort of collaborate? The way I see it, there are many components to being able to deliver these treatments. You have to have some medical knowledge or some knowledge about the body and pharmacology. Shamans who give ayahuasca, they're pharmacologists. They understand that. You also have to have some psychological knowledge, because at least the framework in which we work, we understand personality and we understand human beings, and there's all different types of therapy, but there's a therapeutic piece to all this. And how do we sort of we need to train people from a medical perspective, from a therapy perspective. And then there's this spiritual aspect, which sort of invokes the ceremony of it. There is some ceremony, there's a sacredness to it. That's an important element. And spirituality comes up a lot. And I remember in residency, we started to talk about spirituality a little bit, but I think that being educated and sort of well-versed in spirituality is important, not only just for therapists, even if we didn't have psychedelics, but definitely when it comes to psychedelics, you have to have some knowledge and some training with that. So in my mind, it's like, okay, so, in the interim, if these things get approved, FDA approval, like right now, like MAPS is training therapists, MDs and, therapists of all types to deliver this training, because you're going to have to deliver it as a part of a psychotherapy. Well, when all these things get approved, like what's going to happen and who's going to approve it and what kind of centers? I mean, you need MDs, you need therapists, we're going to need these people who have all this knowledge, who've been practicing this really bravely in the underground, because there's all this wisdom, that can be kind of passed down about these medicines and the sequence and how to use them. And I guess in my mind, I'm just trying to envision and kind of work out what's that going to look like, and what's, here at Helios, we're trying to nail down how to collaborate on this and how to figure out the best way to deliver this kind of medicine using ketamine, as a model, because there's going to be this inner term. I mean, eventually, I've spoken at some conferences where Rick Doblin has talked about, well, we're going to have this psychedelic-assisted psychotherapy license, and we're going to, have this certification program. And I think that's true. There's going to be this training, and I don't know who's going to be eligible to kind of go to it, but, there'll be a training where people will get schooled in non-ordinary states of consciousness. They'll get schooled in spirituality. They'll talk about the ketamine signatures, and, the CIS program that Janice Phelps runs is, a really good model for that. She's already, starting to do it. So that's going to be eventually, but then in the inner term, as I've been training people, both mental health providers, and I've had the opportunity to kind of do a little group with some of the residents around here, medical residents. It's like, so how do we bring people up to speed in the inner term? And how do we start to get this being taught in medical schools and psych programs? And I think there's going to be some pain points and some problems to solve there.
Yeah.
So,
Well, I worry about a big legal, political clamping down again, and I hope that doesn't happen. But that's the danger, is that there'll be this huge sort of reaction, counter reaction.
yeah.
Hope that doesn't happen, because it's really exciting, this place that we're in now of a sort of renewed vision of what's possible, and so many sharing it. And what kind of attitudes are you encountering within the medical community? Are you finding that there is a new opening and enthusiasm among peers about your own same age, would you say?
I think so. I mean, I think it's mixed. I mean, there's a lot of people who are really excited about it. And I think there's some anxiety about it too. I have to say, having the opportunity to go to the MAPS training, I went to one of the trainings in Colorado back in the beginning of the summer. And like I said, there's therapists and people from all different types of training. And, some of the MDs, for example, were kind of overcome by the fact that their whole paradigm is shifting, right? Like, oh my goodness, like I get to, we're talking about, sometimes you need to hold someone's hand, if they're in a difficult, non-ordinary state, or, how you comfort somebody, and, ethics and different things that are involved. But it's really like a whole different paradigm. I mean, psychiatrists were supposed to say, back in the old Freudian model, right? It's like, you're supposed to be the projection screen, say nothing, disclose nothing. I mean, I just told you about my own psychedelic use, and it's
right.
It's a totally different world, and on some level a different frame. I mean, I think we can bring some of the good things from the past, but holding someone's hand or giving them a hug after a psychedelic experience, within an ethical frame is, just, it's kind of table stakes. And so I think that some of my peers are really excited and they're jumping right in. And I have to say, I've been impressed by the residents I've been working with, because they just are really jumping right in. On the other hand, I think that they're worrying about, what does this mean? This is so different, and I think it's a little jarring. So
yeah. Well, you're one of the pioneers. I think you're going to be recognized as one of the pioneers. How do people find you? If do you have a website or something that you would refer our listeners to?
I do. So I have Helios Wellness, and Helios
Helios.
Yes, Helios, and that's my practice here in Woodside. And we have a website, and my email address is drdore@helioswellness.co. And I love talking to people. So about this topic, obviously, you can tell I could talk forever. And so, yeah, I encourage people to reach out to me, and yeah.
Well, hopefully you and I will cross paths, other than in virtual space at some point.
You're always welcome to come down and visit.
Yeah, I would like to do that. I'm sure Jonathan would too.
Yes.
So is there anything else you'd like?
Great psychedelic psychotherapist. He was awesome. It was such an honor to have him here. So
yeah, he's just made for this, I think. Just really born to it. Well, I really want to thank you, Dr. Jennifer Dore, for being my guest today on Shrink Wrap Radio.
Oh, thank you. It was so fun and such an honor.